You are being asked to participate in a medical research study. To decide whether or not you want to be part of the research, the risks and possible benefits of the study are described in a form which is known as informed consent. The consent form describes the purpose, procedures, possible benefits, and risks of the study and explain how your medical information will be used and who may see it. Informed consent ensures that participants know some key points about the research project, like what exactly the study is, what is their role in the study, what are the potential risks and benefits of the study, will it cost money to the participant, who will see the participant's personal health information. Your participation in the research study is strictly voluntary, meaning that you may or may not choose to take part. You may have a copy of this form to review at your leisure or to ask advice from others. You can take as much time as you need to make your decision. Before you make your decision, feel free to talk about this study with anyone you wish. To understand better about informed consent, let's go through a minor case of type 1 diabetes mellitus prevention with oral insulin.
Hi, I'm Michael. I will explain to you about the disease and purpose of the study. Type 1 diabetes is an autoimmune disease. This means that the immune system mistakenly attacks and destroys the cells that produce insulin. The body's ability to produce insulin decreases as the immune system destroys islet cells. Oral insulin has already been tested in a diabetes prevention trial. In the overall study, oral insulin did not delay or prevent diabetes. However, the results suggest that oral insulin may delay diabetes in people with higher levels of insulin autoantibodies. This new study is being done to see if these findings are true in a similar group of people.
What treatment and study design will be followed in this study?
You will have an initial visit, 3-month follow-up visit, and then regular visits every 6 months while you are in the study. At first visit, you will have oral glucose tolerance test, which will tell us how your pancreas works. Then, we will have some blood tests to see if you have diabetes-related antibodies. Then, participants will be divided into 2 groups by random assignment. One group will then receive oral insulin, a capsule every day, which should be swallowed as a capsule, if possible. The other group will receive a placebo. A placebo looks like medicine, but has no medicine in it. Neither you nor the researchers will know who is getting oral insulin and who is getting the placebo.
And what about will be the possible risks and benefits?
Every study has some risks and benefits too. You have the right to have the information of all risks and benefits related to the study. Although this is a research, researchers are still learning. There may be risks and benefits which are not known yet. Potential benefits. Since you are at high risk of developing diabetes, the close observation and frequent testing for diabetes may permit earlier detection and treatment of type 1 diabetes mellitus. Potential risks. There may be bad reaction from drug, minor bruise at the site of blood testing, and may be unknown effects which scientists may not know because they are also in a learning phase, or maybe no specific side effects will be there.
Since all information seems good and transparent to me, its treatment plan and possible risks and benefits, can you also tell me, is there any criteria to get enrolled in this study?
Yes, we have set some parameters to decide the inclusion and exclusion of the participants. Let me explain it to you too, and then we proceed with form filling. 1. Participants having high risk of developing type 1 diabetes mellitus. 2. Participants who have family history of diabetes mellitus 1. 3. Participants who are willing to accept oral insulin therapy. 4. No history of smoking and drinking for previous 3 months. 5. Don't have any pre-planned surgery during the study. 6. No pregnancy or lactation in case of women. 7. No history of any serious disease. 8. Family history of any genetic disorder of participant should be known to the doctor. 9. Any past history of drug, food allergy of the participant should be considered. 10. Any history of medication which participant is receiving otherwise. And 11. Participant menstrual history in case of female.
Will it cost me some money?
No cost is associated with participation in a study. In fact, in some cases, participants receive payments, medications, or follow-up care at no cost. Participants' records will be kept confidential. Participant has the right to decide who can use his or her personal health information. The sponsor, healthcare professionals, and regulatory authorities will be granted direct access to the participant's original medical records for verification of clinical trial procedures.
This much information about the study seems good.
Let's start filling the form. Things you need to keep in mind before filling the form. You are not supposed to be influenced by any other person while filling the form. You can take as much time as you need to fill the information. You can discuss with your family members too before filling this information. You may have a copy of this form to review at your leisure or to ask advice from others. If answer is yes, put if answer is no, and put if answer is I don't know. That's okay. Do you have high risk of type 1 diabetes mellitus due to family history of the disease? Do you fall under the age limit, 18 years to 60 years, adults? Do you take medication for any other illness? Are you willing to accept oral insulin therapy? Do you have ability and willingness to perform self-monitoring blood glucose using plasma glucose meter? Do you have diabetes other than type 1 diabetic mellitus? Do you smoke or drink for previous 3 months? Do you have any pre-planned surgery during the study? In case of women, pregnancy or lactation. Do you have any serious disease? You have the satisfactory information about the study in which you are willing to participate. You can fill the consent form. Things you need to keep in mind before filling the form. You are not supposed to be influenced by any other person while filling the form. You can take as much time as you need to fill the information. You can discuss with your family members too before filling this information. You may have a copy of this form to review at your leisure or to ask advice from others. Type 1 diabetes mellitus prevention with oral insulin. 1. Do you understand that you have been asked to be in a research study? 2. Have you read and received a copy of the attached information sheet? 3. Have you had time to think about what is involved if you choose to join this study? 4. Do you understand the benefits and risks involved in taking part in this research study? 5. Have you had an opportunity to ask questions and discuss this study? 6. Do you understand that you are free to refuse to participate or withdraw from the study at any time? You do not have to give a reason and it will not affect your care. 7. Has the issue of confidentiality been explained to you? Do you understand who will have access to your records, including personally identifiable health information? And 8. Do you want the investigators to inform your family doctor that you are participating in this research study? If so, please provide your doctor's name.
What if I change my mind in between the study?
That's okay. In case you change your mind after participating in the study, you can withdraw the study. Means you do not have to participate in the study if you don't want to. Also, a review panel is there to review each research study, known as Institutional Review Board, IRB. IRB is there to protect your rights, and you are free to call them at any time if you have any concern. But in case of severe illness or side effects where a patient does not have decision-making capacity, then investigator will take the decision to safeguard the health of the subject. Still, if the patient wants to discontinue the treatment, then he or she is asked to sign an against medical advice form to protect the healthcare provider from legal liability for not providing the disputed treatment. There is also procedure for alternative treatment that may be available to the participant in case of any complication develops. All new information or new findings during the research is provided to you, so it assures your continuation with the studies.